Good afternoon. I'm Lucy Caldwell, the Director of Communications for the Fairfax County Health Department. Today, we're looking at a topic that's very near and dear to my heart as a former communications staff member for the Fairfax County Police Department and the Fairfax Falls Church Community Services Board. Both agencies work very closely with the health department on the topic that we're going to talk about today. Today marks the first week of May, which is Mental Health Month. And as you know, and it's often said, there is no health without mental health. So, here at the Fairfax County Health Department, we wanted to begin some conversations with our community and with the people who are active in dealing with issues and responding to issues and reaching out in advance of issues that have to do with mental health. And so every Wednesday during the month of May, we are going to have brief conversations with newsmakers, with people who are here on the front lines, actively involved in mental health issues in Fairfax County and the cities of Fairfax and Falls Church. So today we have, and we're very honored to have, Ellen Volo here with us. She is the coordinator of the Fairfax County Opioid and Substance Use Task Force. And what she's going to talk about is to help all of us understand the local issue, what's happening now, what's being done, what we can all do to live in a healthier and safer community. Ellen is, as I said, she is the coordinator of the task force, and many people who are watching may not be aware that there is a task force. So I want to hear a little bit, Ellen, about your background and about the task force, who's involved, what are the goals, and how long has it been active?
Sure, and thank you for having me today, Lucy. So, Fairfax County has had a targeted effort to address the local impacts of the opioid epidemic for over 5 years now. And it's really a collaborative, cross systems approach involving all different facets of county government. Of course, the police department's very involved, as is the health department, the community services board, the fire and rescue department, our court system, Department of Family Services, neighborhood and community schools, many other county agencies. And we're really working hand in hand to try to address this complex issue. We have over 30 different programs and activities underway to try to address the opioid epidemic. Those range from prevention to treatment to harm reduction to public safety initiatives, and of course, recovery. And we really are all working towards the goals of reducing opioid related deaths and using data to really drive our work, better understand the local problem, and target our interventions.
What's the history of the task force? How was it recognized that this would be a valuable tool to coordinate?
Yeah, so the Board of Supervisors actually created the task force. They asked, staff to come up with a plan to address the opioid epidemic, and that first plan is when the task force really formally was created. And at that point, the Board of Supervisors put aside kind of a separate pot of money, if you will, to address some of these opioid issues and start up some really innovative programs that we're lucky to have here in Fairfax.
That's good to know. Um, when we think about substance use disorder and the use of opioids, it's not just like somebody wakes up one day and says, I'm going to try this or I'm going to do this. Many times, sadly, uh, this begins with some type of other co occurring, either a depression or a trauma, something that happened to an individual. um, the effects of opioid abuse on the brain, obviously, they change somebody over time, they change families. Can you share what some of the ways that the task force is educating people about the dangers and the risks of opioids and how early involvement and early use or even trying it can really impact substance use disorder later?
Yeah, absolutely. So that prevention piece is really a key part of our work. And so we do have kind of a whole portfolio of prevention work underway. Um, there's a program, a website called KnowRx. That's a great resource on kind of the dangers associated with opioid prescriptions and kind of talking to your doctor about alternatives. Safe storage and disposal of medication is something that we really promote as well, because we know that, sometimes improperly used prescriptions can lead to opioid misuse. And so we really want to prevent that from ever starting. We also have in Fairfax County, led by our Fairfax County Public Schools partners, a program called the Substance Abuse Prevention Specialist Program, where there are counselors at as a resource for the middle and high schools to educate youth and do a lot of programming around, substance use prevention and also early intervention.
I will say that's a really good point about preventing and the early intervention with young people or people who are entering your home. And the safe storage is key. Think about your lives and how, let's say, you have somebody to mow your yard, or maybe somebody comes in to feed your cat while you're away, or something like that. What's in your medicine chest? Are there medications that sadly people could say, I think I'm going to take these and either use them or sell them. And so a lot of times people do need to think beyond, don't they? Beyond their daily, everyday actions and think about the whole picture and their whole homes and the risks. And it's really important, isn't it?
Exactly. And we do have resources available to the community through the Fairfax Falls Church CSB. So you can request a medication lockbox. You can also request a drug disposal pouch. There's also drug disposal boxes at all of our police stations that you can go to, year round. And there's ways to safely dispose of your medication at home. So some of that information you can find on the county website by going to the opioids page. You can just search for opioids, and some of it's also available on the health department's page.
And it's
We
just
also,
those No, I'm sorry. It's just those small actions sometimes that can prevent opioids or any kind of medication from falling into hands. And I'm going to bring up a difficult topic, which is fentanyl. And fentanyl is just a tiny substance, the size of a grain of sand, but it's incredibly powerful. It's used in medical procedures as a painkiller. But what we're seeing with fentanyl and what we're reading in the headlines day after day is just that it takes such a small amount. And sometimes it's by accident. Nobody means to overdose, but if they take that one drug, which maybe they didn't even know what it was, and there happens to be fentanyl in that, you could have tragic consequences just by, in the old days, 40 years ago, was youthful experimenting. It can be deadly now. What are you seeing with the task force and with the partners that pertains to fentanyl here in Fairfax County or in the region?
yeah, thank you. Excuse me. Thank you for bringing that up, Lucy, because that is really such a critical message that the community needs to be aware of. Fairfax County, just like jurisdictions across the state and nation, is seeing a lot of fentanyl related fatal overdoses. In recent years, in the local Fairfax community, most of our fatal opioid overdoses have involved fentanyl, and that tracks with what we're seeing statewide and nationally as well. Now, fentanyl can be found in a lot of illicit substances, cocaine, heroin, um, MDMA, what's commonly known as ecstasy or Molly, and also of great concern lately is counterfeit pills. These counterfeit pills that have fentanyl in them can look exactly like what you might get from a pharmacy. And so it is impossible to know, what is in these pills and how deadly they could be. Um, And this is absolutely an issue that, is impacting the Fairfax community and the Northern Virginia region. Sadly, we saw just last week two fatal overdoses involving young kids, 14 and 15, in Prince William County. And law enforcement suspect that it was fentanyl laced Percocets that were involved in that. So, this is a really important issue that everyone in the community should be aware of.
Absolutely. The police oftentimes are the unit within Fairfax County government that sees what's happening out there on the street in the front lines. And then when they communicate that to the other county agencies and subject matter experts, then they look at what can we do? How can we get messages out to people who are either experimenting with drugs or using drugs? How can we get these messages out that this particular substance is here in our community? Have you
Mhm.
seen, or has the task force seen, that there are certain populations that are more vulnerable to opioids or fentanyl poisoning? You talked a little bit about youth.
Yeah, so, it can really it's everyone's vulnerable to it. Fentanyl and opioid overdoses can really happen to anyone. And we know in our local data that there's, a wide range of ages of people who fatally overdose in the Fairfax community and non-fatally overdose as well. And from all geographic areas of the county. I'll highlight just a couple examples that we're kind of aware of and very concerning involving fentanyl. You may remember that last fall, the police department did a press conference following an overdose incident where six young adults, kind of in their mid 20s and 30s, kind of overdosed all at one scene. And that was reportedly attributed to cocaine mixed with fentanyl. And then, more recently, in the last few months, our police department has also observed an uptick in youth non-fatal overdoses here in the Fairfax community, and really illicit pills, including what we suspect to be fentanyl, are the primary substances involved in those. So it really is kind of all age ranges, and it's a community problem that I think the entire community needs to be aware of and to really help try to address.
Yeah, there's no typical user of drugs or opioids, and that's why mental health and recognizing what are the signs of substance use. Do you have those sort of prevention and the recognition programs here in Fairfax County that you want to share?
Yeah, absolutely. So, in Fairfax, youth substance use is kind of an ongoing area of concern, and we have a lot of prevention work focused on that as part of our kind of daily operating procedures. Following the uptick that I mentioned that police have observed with youth non-fatal overdoses, we have been doing a lot to amplify that work and that messaging. One of the activities that we recently completed was a webinar that was done jointly with the Fairfax County Public School System on youth substance use trends. That is a phenomenal resource for parents. It highlights kind of some of what we're seeing from law enforcement and also what we're seeing in our public health data. Then it talks through, what opioids are, how to recognize signs and symptoms of use and overdose, what to do if you are concerned about your child's use or drug use of someone else that you love in your life. And we go through various resources in the community that are available, both through the school system, but also through the county. So that you can get to again by going to that kind of opioids topic page that I mentioned. The recording is now available online, as are the presentation slides. So that's one resource. There's also a lot of other work being done by the SAPs, the substance abuse prevention specialists that I mentioned in the school system, the counties, the Fairfax Falls Church Community Services Board, which is our local behavioral health agency, has ongoing revive trainings. And Revive trainings are a really important resource. It's a free training. You can do it virtually in an hour. Goes through how to recognize an overdose and what to do, how to help save a life if someone around you is overdosing. And for Fairfax residents who complete that training, you get mailed a free dose of Narcan, which is the medication that reverses an opioid overdose, as well as, treatment information and other resources. So that is a resource that I highly encourage people to take advantage of. Again, it's a free training, lots of training dates, also available in Spanish. And if you have an organization that would be interested in taking that training, you can also request that a session be specifically created for your group.
That's outstanding. Also, tell us a little bit about the Prevention Coalition for Fairfax County.
Yeah, that's another great resource. Thanks for bringing that up. So,
Hmm.
the Fairfax Prevention Coalition is our community engagement arm of the task force, and it brings together a lot of different community partners working on a range of drug use prevention issues. So they do a lot of work on opioids. They also do work on, alcohol use and marijuana and vaping. And the idea is really to bring together people from many different organizations to kind of work together, get out different messaging, spread the word about prevention, and get the community involved in these prevention efforts. And so you can sign up to participate in the Fairfax Prevention Coalition. We are always looking for more members. Again, you can get that information through the opioid topic page.
Excellent. We talk about what the task force is doing and what the policies are and, data. But what it comes down to is that mental health and substance use disorder impacts almost every family at some time in their life. So I think Fairfax County and just hearing everything that's happening with all the agencies and all the opportunities for residents to get involved really is important. And I think that everyone realizing that they can make a difference, they can save a life, and that it's important that we all take action. And of course, it's tough because we have full lives and we're all, our hands are full pretty much, and our hands are tied, we may feel. But the truth is, there are opportunities out there, and all you have to do is go to one of those websites that Ellen Volo shared, or just Google getting help in Fairfax County for opioids or substance use disorder. And thanks to all the different efforts going on with the schools, with the faith community, and with all the government agencies that Ellen mentioned, really it gives you a lot of hope that there is something we can do, that there are many things that are being done, that we have to know what the warning signs are of trouble and of substance use disorder, whether it's in a young person or any age. It doesn't know boundaries, it doesn't know socioeconomic status, it doesn't know your wealth, income. It impacts everyone, unfortunately. But getting help early, knowing that treatment is available, knowing that substance use disorder is preventable, and really about having hope in recovery. That's what it's all about. And during Mental Health Month, we're happy to share that information, and we hope that you will have those conversations at home and will share this information. And please get in touch with Ellen Volo or someone at the Opioid Task Force. I hope I said that right. But do you have anything else you'd like to share before we go and before we sign off? And thank you to everybody who took your time today during your lunchtime to view this.
Yeah, and thank you. I'd like to echo that. Thanks. We talked a lot about prevention resources, and you touched on all the treatment options that are available. But I really want to underscore that in Fairfax County, there are a lot of treatment resources available. If you or someone is struggling with opioid or substance use issues, and please go to the opioid topic page. There's all different information about how to get help. The Fairfax Falls Church Community Services Board has a detox center that's available 24/7. We also have emergency services, kind of a front door for just getting assessments and starting that process. And then one resource in particular that's really phenomenal is our peer outreach response team. This is a team of peer support specialists who will provide support to people who are, struggling with opioid and substance use, help them navigate the different resources and connect to treatment. It's available to anyone in the Fairfax community. You can refer yourself, you can refer your loved one. So, and they have really phenomenal outcomes. They are life changing, like so many of our other programs. So please check them out if you or anyone you know is struggling with substance use.
And that information is on the opioid webpage.
It is. So you can go to that opioid page that's kind of been shared. There it is. It's being shared again. You can go to the county website and just search for opioids, and you'll be taken to a page that has all the resources we talked about today, including those numbers on how to get help.
Excellent. Thank you so much. And thank you for all the work you're doing with the task force and really for making a difference. And thank you, everybody, for tuning in. And we hope you'll get involved and get engaged and help save lives here in Fairfax County.